everybody. It's a privilege having you guys all here, and I hope by the end of the night it'll be a privilege for you to come and serve the community with us. My name is Hugo. I'm a shift manager, and usually during the clinic we have two shift managers. We have one in the front and then one in the back. So tonight you have Spencer Perloff. He's going to be your back manager, and in the front is going to be Dan Pierce. So our jobs here basically is to direct the flow of clinic. And so if you have any questions during this time, we're the go-to people for you. All right, so as an overview of the orientation, what I'm going to do is I'm going to give you a small tour of what makes up HOPES, and then how it all fits together, then putting that all together, what your role is with each part of HOPES. Cool. Okay, so behind you is the lobby, and that's the first place that the patients come in. So we have new patients and we have follow-up patients. In the front we have what we call the front desk, and that's usually manned by the first years, PA students, essays, and that's where we receive our patients. Okay, now, just to warn you, this is going to be a lot of information if this is the first time you're here. It's going to be like a crash course on how HOPES works. But if there's one time you should listen is when I say as a clinician. Okay, so that's when you should tune in your ears, and you can listen to what role you have in that part of the clinic. Okay, so as a clinician, in the lobby, that's going to be where you're receiving your patients. You're going to go out there with your teammate, and you're going to call out the patient's name, personally introduce yourself, and then you're going to bring them back. Once you enter through these doors, this is the clinic. So you can see on the right side over there, that's the vital station. Okay. As a clinician, for your first patient, you have to take your vitals. Ideally, after that, every other patient they'll have their vitals taken already by one of the shift managers. Now, if it happens to be backed up, you actually have BP cuffs in the exam rooms for you. So what you can do is you can go there, you can take your vitals, you can come back out to get the height and the weight afterwards. Right? So right here, this is normally where our lab team room is. Today we have Soheb working, so he'll be your lab team. And that's one of the tools you have here while you're at HOPES. So as a clinician, the tools you have is a UA, which is urinalysis, Hemocolt, peak flow, EKG if you really need it, pregnancy test, and also, am I missing anything?
Glucose.
And glucose check. Okay, so those are the tools that you have. So if you have any questions, you wanna use one of the labs, you can talk to Soheb. Okay. So behind me, that's what we call home base. Now, if you're not in the exam room, the place that you should be is home base most of the time. And that's the place where the attendings will be. That's the place where you'll be presenting, preparing to present, and taking notes. Okay? It's important to stay over there because it keeps the noise level down and it increases efficiency, but it's not cluttered here. Okay? So if you can follow me. So this is where the magic happens. This is where you'll be spending most of your time. So on the board here we have the names of the clinicians, and the seniors already put their names on there. If you're a junior clinician, can you put your name on the room number that you'll be working in? So as a clinician, these are the rooms where you'll be seeing your patients. Okay? So this is a free clinic and student run, and so that means we have limited time, and efficiency is highly encouraged. Okay? And so because of that, we have a few tips we have for you. So when it's a follow-up patient, you're going to be given 20 minutes. If it's a new patient, you're given 25 minutes, which is followed by a knock. After that, you're going to have to wrap up with the patients. One thing you can do is you can keep your visit to one chief complaint and one minor complaint. Another thing, if they're a follow-up patient, I'll look at their chart from beforehand and see what the reason is for their follow-up. And that can kind of guide you for your visit today. Okay. So here you do have a few tools. We have the otoscopes, the ophthalmoscopes, the general labs that we already noted. We also have Sentara self-test. So we are very limited in the labs that we have, but here's a list of labs that Sentara offers. This is not a free ticket. So if you give this to your patient, please explain to them that it's kind of like a check-off list. It makes it easier, so if they don't remember the names of the test that they need, you check it off here, it tells you the price, and they can bring it to Sentara and get the test there. Okay. Second, we have formularies, which is just a list of the lower cost medications in your local Walgreens or your Walmart. And we have, and also we do Chesapeake imaging. So if you have a patient and you think can benefit from imaging, then talk to the attending. If the attending thinks that that's something that's beneficial for the patient, then we can have a form for them to fill out. Next to that we have your chart, which is probably your most important tool. So this is your chart right here. The way I like to think about it is this is on the left side. Left side, left behind, in the past. So this is where your past medical history is going to be, your social history, and your medications. Important for especially the senior clinicians or yeah, especially the senior clinicians, make sure to update the medication list on the right side, oh, left side, okay? And then the left side we have, no, the right side right now in the present, okay? So this is all the information right now for your visit. So you can have your review of systems, your SOAP note, and also your prescriptions. Okay. One thing to note is when it comes to your prescriptions, this is kind of a basic format of how to fill out a prescription. If you're a senior and you already know how to do it, you can teach a junior how to do it. It'll be beneficial. This is key. This is important because a lot of the times we write this prescription at the wrong dosage. We can't read the writing, and so when the patient goes to the pharmacy, they send it back to us. And what happens is we have to reschedule the patient for another time, and the next time they come in here, they're taking a spot of the patient that actually really needs help. So, as a clinician, I would double check the prescription, make sure that all 9 points are there before you give it to your patient. Okay. So there's that, and let's see. At the end, oh, actually, at the bottom of this too, on the right side, is 3 blank spaces for signatures. Okay. So one's going to be for the junior, one's going to be for the senior, and one's going to be for the attending. So all 3 signatures have to be filled out before you get your next patient. And so what I'm going to do now is I'm going to kind of recap the entire flow of the clinic and how you fit into the picture. Okay? So as a clinician, you're going to be all the way in the back in home base. You can start off. When the patient comes in here and their charts are ready, the clinic manager in the back is going to come over, and it's a first come, first served basis. So whoever's ready, whatever med team wants the patient, they can take the patient. So you prep for about 2 minutes or so, and then when you're ready, you're going to go out in the front, in the lobby. You can introduce yourself to the patient. You can bring them back here. Okay, you have 20 or 25 minutes, depending on what kind of patient you have, to do the history. You can get a knock. Afterwards, you can head back to home base, where you're going to prepare, and if attending is ready, then you're going to present to your attending. After you present with your attending, the attending is going to come back with you. You can finish up the visit. And at the end of that, you're going to go to continuity coordinators. Okay, so they're like these 2 rooms here, but on the other side of this wall. You have to walk your patient there. You enter the room, introduce your patient, the chief complaint, and then you stay there for a few seconds or so because the continuity coordinators usually like to ask us a few questions about the visit and make sure it's kind of like quality control, making sure that the patient understands what they've learned today. So we have that. Okay, so that's the entire flow, but there's a few emergencies I keep in mind. If there happen to be emergencies, then you go see either the back manager or the front manager. Some emergencies are the worst headache you've ever had, blood pressure greater than 200/100, syncope, which is just fainting, shortness of breath, chest pain, or suicidal ideation. Okay. Clinic coordinators we have today is Rob. Is there anything you'd like to say? Do the continuity coordinators have anything to say? Sweet. Okay, so last thing I have to say, the prognosis of the day. It's 30 patients. It's a heavy load. It's a combination of, most of them are follow-up patients. I think there's 1 new patient, and then the rest are Strelitz. And so, if you want to get out of here on time, I'd encourage you to work efficiently. Cool. So if you have any questions, just let me know.